Hey everyone, Jonathan Bailor back. A very unique and I anticipate excellent show for you today. We have a clinical psychologist with us who specializes in the treatment of anxiety disorders and related problems and has done so for more than 2 decades. He was the director for many, many years of the Anxiety Treatment Center in San Jose and Santa Rosa, California. He has written 6 books, many of which are best-selling anxiety workbooks and have helped hundreds of thousands of readers throughout the world. We have none other than Dr. Edmund Bourne with us, and I wanted to share the good doctor's work because I got to tell you, we spend a lot of time worrying about how we look in this world. So when we talk about worry and anxiety and living a smarter, healthier, and happier life, knowing how to deal with some of this anxiety that comes up is just critical. So Dr. Edmund Bourne, or Ed, welcome to the show.
Mm-hmm. It's a pleasure to be with you, Jonathan, and looking forward to our short but hopefully useful interview.
Well, Ed, I know we were talking before the show, and you mentioned one of the issues we want to cover is cognitive behavioral therapy. And for something that can potentially take years to retrain the mind, we've got about 30 minutes here, so we're going to try to power through a little bit.
Well, there are 7 different anxiety disorders, panic disorder, and then panic disorder with agoraphobia, which means you're not only having panic attacks, but you're restricting your activities as a result of those panic attacks. And then social phobia, where you're fearful of being in social situations, fearful of how you look or what you'll say in social situations. Then there is generalized anxiety disorder, which is a long way of just saying too much worry. People with generalized anxiety disorder are excessively worrying. Then there are specific phobias. Right? Your problem may be just a fear of flying, or maybe just a fear of going to the dentist. Beyond that, there are the obsessive-compulsive disorder, which really deserves to be a field of study of its own because it's a little different in terms of its nature and treatment from the other anxiety disorders. And finally, number 7 is post-traumatic stress disorder, which again is really its own field in terms of the way we think about it and the way it's treated. There are different organizations that are devoted just to treating post-traumatic stress disorder, which is long story short, is basically a severe anxiety and recurring anxiety reaction someone has after a bad trauma, like being in a car accident or being raped, or certainly common in combat situations. So that's the overview. We've got
Ed,
7 different things.
If I can just jump in real quick here, do you mind? Could we focus? Certainly, this is a enormous field. Many people are impacted by it. Just levels and levels of complexity. But I know myself, and I bet a bunch of our listeners, we might find ourselves sometimes thinking, "I just worry too daggone much, and I wish I could worry less." And we may not have a disorder per se. I think we all worry. But let me ask you 2 specific questions. One is, what is the difference, or how could we self-evaluate between a normal amount of worry and a disordered amount of worry?
I think that's actually a subjective evaluation. The question is, are you suffering and are you in distress because of the amount of worrying you're doing? Would be criteria number 1. And criteria number 2 is, are you worrying about your own worrying? Are you feeling anxiety because of the amount of worrying you find yourself involved with? So the people who read my book will find that there are multiple ways you go about working with. Let's just say you're an excessive worrier. There are basically the standard of care is cognitive behavioral therapy, and in severe cases, medication. So hopefully people can benefit from natural approaches in CBT, cognitive behavioral therapy. But if they really have a very severe situation, then they have to start talking about medications like the SSRIs and the SNRIs and possibly even the tranquilizers. But let's just say you worry too much. Well, first you want to know, are you worried about a specific topic? And then we sort of need to explore, where did that come from, what's going on there, and then cognitive behavioral therapy would involve both a combination of practicing deep relaxation techniques on a daily basis just to help you relax a little bit, as well as identifying the specific worrisome thoughts. Every worried thought begins with a what if. Whatever the worry is, it's always going to begin with a what if blank. So in cognitive behavioral therapy, we want to identify the specific what ifs and then develop what are called counterstatements to each of them. In other words, instead of, what if the airplane crashes? The counterstatement is the odds of the airplane that I'm traveling on crashing are actually 1 in 17 million, which is the official odds. Or what if I'm afraid of going to the dentist? The counterstatement is I can incrementally learn to be free of fears of going to the dentist. And then, not to get too complicated here, but wherever there's a phobia, there needs to be what's called exposure. Long story short is, to get over a situation you avoid, you got to face it. But the way facing it is made possible is to do it in small incremental steps. I'll give you a quick example. Suppose you're afraid of flying. Well, you're not going to go out and just take a flight. What you're going to do is you're going to go out and do what's called the incremental process of, maybe getting used to the airport, and then secondly, with the cooperation of the airlines, actually boarding a plane and then getting off a plane that doesn't take off. And then next, ultimately making a very short flight with a support person going with you. And then beyond that, making a short flight with nobody with you, and then making a long flight with everybody with you. So that's what I mean by sort of trying to break down the facing of a fear into a series of incremental steps. And that's critical to the cognitive behavioral approach to
Ed,
dealing with.
I love this idea of breaking down a specific source of worry and tackling that. And I'm hoping we might be able to dig into a real life example here. And that is, I know a lot of my listeners, we worry about our weight. And I am not a PhD. I am not a clinical psychologist. So my flippant remark is throw your scale away. Like, if it's not there, you don't need to worry about it anymore. Just like throw it away. And people say to me, Jonathan, that's great. I love your energy, but it's not that easy. So how can we work through this constant worry, which for some of us may actually borderline on obsessive compulsive disorder, about this number, which really is not meaningful in and of itself?
Well, there are a lot of ways to go with that, but the very first and most common sense thing is to cut down on the amount of checking. And in the technical word for that is response prevention, or treating this as if it were an obsessive problem. Certainly, the more you check your weight, the more you're going to be, preoccupied with it. So gradually, maybe not all at once, cutting down the number of checks, ideally getting to the point where you might just have one check per day, or maybe one check per every 3 or 4 days. So that would be, one approach. Then getting a little more fine-grained, we're going to look at, well, what are the specific worries? What are the what ifs you're telling yourself about your weight or about your inability to lose weight? And let's identify those, and then let's develop constructive counterstatements to them.
Well, and Ed, I love those counter statements. That's what I want to drill into because, again, you're the expert here. The thing that I have found in my own experience and in working with clients back in my personal trainer days is one of those what-if statements is, for example, if I weigh 5 more pounds, on some level, people won't like me as much. Like either my spouse won't find me attractive, but the worry there, to me, isn't actually about the weight. The worry is about someone treating you differently based upon what you think would be a negative change in your physical appearance.
Okay.
And the reason I dig into that is, like, let's say, for example, we actually do resistance training and we build up our muscles. If we build up our muscles, we'll gain weight. But oftentimes that will result in a positive change in our physical appearance. So when we hang our hat on this number on the scale, we are worried about something that actually has very little bearing on the actual things we're worried about, which is how people maybe treat us or think about us. What do you think about that?
Okay, that's a long question. I'm hoping I'm really addressing your question. I think your question boils down to worrying about the number and worrying about getting over that number and what are people going to think of me if I gain 5 pounds or 10 pounds. And I would say that one thing that's indicative of all worries is that they overestimate the odds of unpleasant or even dangerous consequences. And number 2, you underestimate your ability to cope. So so first you deal with the overestimates of, if I gain 5 or 10 pounds, XYZ is not going to like me as well. And you look at, what are the odds of that really being true? What are the odds if I gain 10 or 15 pounds that I'm going to experience some level of rejection as a result of that? And usually the person who's doing the worrying is overestimating the risk of negative consequences. Now, if you've got a spouse who's on your case about your appearance, well, then we're dealing with a marital problem, and we're dealing with couples therapy, and we're dealing with, what are reasonable expectations and so forth. I'm not denying that some of your listeners may have somebody very important in their life that is not fully accepting of their present weight. So then I guess we have to talk about, under the other part of it, the underestimating your ability to cope. Then we have to look at, what can you do to cope? I mean, if your spouse is having problems because of your appearance, let's work on that. Let's maybe have a session with a couples therapist and see what we can do. I mean, to perhaps help the spouse alter their expectations, or perhaps help the person with a weight issue to take constructive steps that will be effective to diminish weight. And of course, I'm not an expert on weight control and weight management. There are many, many ways to go about working with that your listeners probably are more familiar with than I am. I've always had I'll admit that I've always had a problem with underweight, which, people also were then worried about not fitting the stereotype.
Well, and Ed, I think that the key distinction I'm looking at here is there are things which, hypothetically, let's say a woman walks into a party and she looks fabulous. She looks radiant. Her smile just glistens. Her hair looks lovely. The way she carries herself, the way she engages with people, she lights up the room. And I were to tell you that woman weighs 200 pounds. Like, it would not matter, that no one cares. This number is so meaningless in and of itself. Let me give you another example. If you look up a picture of me on the internet, you will probably not think I'm overweight. According to my weight, I'm borderline obese. I happen to carry quite a bit of muscle on my body. So we have this.
Who decides that? Who decides that you're overweight or obese? Who decides that?
Well, that's what I'm saying. So there's these
the American Dietary Association.
Exactly. Yes. But that's so how do we combat that when we have our value tied to this number, which even science clearly shows that, like, for example, your waist circumference does have bearing on mortality rates, but your weight in and of itself really doesn't. So, but we use this scale, we get preoccupied with it, we're constantly weighing ourselves. How do we break that cycle?
There's no quick and easy answer other than to reduce the number of checks. Maybe reduce it gradually, but to reduce it, to get it down from, many times a day to once, maybe twice a day, and then get it down to once a day, and then get it down to once every 3 or 4 days if possible. And that just is an act of will. I mean, it's that kind of effort takes courage and willpower to sustain, and that's what, it sounds kind of commonsensical, but that is what you do. About you want to reduce your checking, and you want to reduce the perception that a certain number is bad, because the question is, bad according to who? I mean, even if you are a little overweight, as you said, you can dress yourself and do, if you're a woman, cosmetic things and things with your hair that can allow you to be strikingly beautiful, even if you are 20 pounds over the norm. In addition to that, I think, just a reminder, hey, this is a very cultural thing. In America and in Western Europe. If I'm part of Hawaiian culture, it's like really a very good thing to look overweight. And there are many cultures outside of the United States and Western Europe where people are actually, it's preferable to be overweight. It means you're well fed. It means you're from an upstanding and financially well off family if you're a little robust.
I love.
So again, where you have this cultural obsession in the U.S. and in Western Europe and a few other places with being thin, and it's a cultural lie that's unfortunately gotten sold by the people that are out there to make money off of weight reduction. So that's my take.
Well, no, I love that, and I love what you said also about Jonathan. I can't just give you this easy answer, because the other thing I heard from what you were saying and just from knowing a bit about your research is, if you're checking your weight constantly and you're constantly worried about your weight, like you said, there's no easy answer, and I anticipate
checking begets worry.
Exactly.
And then worry begets checking. It's a circular.
Exactly. And you're not,
less checking, less worry.
Exactly. Well, and it seems like you're also not, the reason it's not easy to stop is because you're not really doing that just to check your weight. Like it sounds like there's something deeper, and it would be that we would need to address that deeper. What is the why that is driving you to check your weight constantly?
Well, yeah, I would assume worry about disapproval from loved ones or just everybody, and so then you have to look at. I just go back to people who worry, overestimate the bad consequences. Mm-hmm. They're overestimating rejection or disapproval from what it actually is going to be. Mm-hmm. Now, okay, let's take the person who's really, really overweight, who's, really quite obese. Yes, there is within our culture a certain disapproval of that. But where I would go from there is that if you look at surveys, 80% of the American population has something wrong. Some diagnosable problem within the DSM, the psychiatric manual for disorders. That leaves 20% of people that don't have some diagnosable problem. So your issue is weight. Your issue is you're a little overweight. Okay, well, the next person, might have an issue, with high blood pressure, and the next person might have an issue with, something much more serious than being overweight. Let's say ALS or muscular dystrophy, or is 80% of the population has something wrong. So if yours is weighing too much, okay, that's yours. It's got to be taken out of part of one's evaluation of oneself. Having the whole basis of self-esteem is to get away from the idea that your appearance is the basis of your self-esteem. And I think that's the knot that has to be untied. That's the knot that has to be cut, is that your self-esteem is dependent on how you look. But you're not inherently valuable, worthy, good person, regardless of your weight. That's where it ultimately has to go. It has to go to basing your self-esteem on true criteria and not on superficial criteria.
Well, I love that, Ed, and I think you hit an interesting point in there when you talked about the 80% of us. Probably 100% of us are not perfect. And certainly when we talk about individuals who are checking the scale, if you weigh 450 pounds, that's not healthy. And you're probably also not checking the scale every day because you don't need to stand on a scale to know that you weigh an excessive amount, right? We're talking generally people that do this, in my experience, are people where if you looked at them, you would not think they're overweight at all. And they're fretting, like to your point of they're overestimating. If you were to gain 50 pounds of body fat, that's a bad idea. And you should stop and you should get help because that's not healthy. But most people aren't worried that they're going to step on the scale tomorrow and weigh 50 pounds more. They're worried about these 1 to 2 pound fluctuations. And Ed, to your point, nobody, even if you did gain 2 pounds of body fat, as long as you don't do that for 30 days in a row, nobody is going to treat you any differently.
Absolutely.
Because you gain 2 pounds of body fat or because you gain 2 pounds of water weight because it happens to be that time of the month. And that's, I love your point about we're over. Let's say it does happen. What's going to change? And I think it's all just your own perception, self-perception. Nothing has changed from an external point of view. If you gain 5 pounds, nothing has changed from an external point of view. It's just obsessing with numbers. You could obsess about, I suppose, wrinkles around your eyes, or you could obsess about a number of physical things that occur with aging. Like you could obsess about the fact that you might have some loose skin in your neck, or you might have some jowls in your cheeks because you're getting older. Bodily focus, excessive bodily focus. You can go in many places. Weight is certainly a very popular one, but all of these things have to ultimately have the same answer. That you aren't who you appear. You aren't your looks. And unfortunately, there's a lot of advertising that would want you to believe that you are your looks, but in truth, you're much, as a human being, your inherent value is based on far deeper and significant criteria than your looks. So it's like getting away from that kind of it's a cultural obsession that's become an individual obsession, and it is if I was counseling somebody, I would just work on finding ways to
evaluate, and apart from doing less checking, which is really the first step, is finding legitimate values for self-worth and self-esteem, getting out of the trap of basing it on your looks.
Ed, I think that is just, I want to end on that because I think that is such a powerful message, which is focus on the other. If let's say, even if you do think you're not beautiful or not this in this certain way, you are beautiful in other ways and more important ways. And if we can focus, because Ed, often we talk about the idea is not just to eat less food. That's starvation. That's unhealthy. You need to eat higher quality food. It's almost like we do the same thing here. Think about
get away from the processed stuff.
Exactly, and think about give yourself higher quality thoughts and focus on the higher order bits of why you are valuable. And maybe you could even then crowd out those negative thoughts.
Over time, you can.
I love it. Well, Ed, thank you so much. And folks, obviously, we are only able to scratch the surface. This is obviously a hugely complicated area. And Dr. Bourne has spent just decades breaking it down. He's got many books you can check out. He's got the Anxiety and Phobia Workbook, Healing Fear, Beyond Anxiety and Phobia, Coping with Anxiety, and a natural relief for anxiety. And all of that and more can be found at his wonderful website, which is helpforanxiety.com. Again, that's helpforanxiety.com. And the man is Dr. Edmund Bourne, PhD, clinical psychologist. Ed, thank you so much for sharing your time with us today. I really appreciate it.
Thank you, Jonathan. It's been an honor.
Folks, I hope you enjoyed today's show as much as I did, and remember this week and every week after. Eat smarter, exercise smarter, and live better. Talk with you soon.